I am Dr. Srinivas, Chief of Cardiology, VSH Superspeciality Hospital. Is a multi-speciality hospital situated in the heart of city in Bangalore. And there are a lot of myths about young individuals getting into heart attacks. So I am here to say few words about it. That it is true that young individuals are also prone for attacks. And yeah, I would say yes. And mainly because of the change in the lifestyle, the stressful situation, habits, dieting, and the obesity, as well as the heredity factors. All those things increase the risk of heart attacks in young people. The next question will arise is, what are all the common symptoms of heart attacks in young people? So heart attack is heart attack whether it is young or old, the symptoms are the same. That is excruciating pain, something excruciating, pain in the center of the chest, associated with sweating, then palpitation, breathlessness, and fear of death, impending death. So those are the symptoms of which should last for at least half an hour or more on the signs of heart attacks. And if you ask me, is the symptoms different from heart attack in young people or elderly? The symptoms are generally the same, but elderly, they are more, they tend to tolerate the symptoms better. So they tolerate the symptom to the extent, the largest extent, whereas young people, because they have not experienced such pain, they will develop a lot of anxiety, and anxiety symptoms are more in younger people. So the risk factors why the young people are developing heart attacks are nowadays smoking is, I would put smoking as a first. The heredity factors, then dietary restriction is not there. So whatever the junk foods and fat-rich foods they are taking, and lack of exercise, they are obese, that obesity, all those things, and the stress and strain of job and situations make them, young people, develop heart attacks. What are the lifestyle changes which I would suggest is, first and foremost, the maintenance of weight loss is important. Dietary habits have to be taken care, that is eating a healthy diet and exercising regularly, at least 3 to 4 times a week. 4 times a week is good exercises for at least half an hour. They should be able to do it. And avoidance of smoking, alcohol, all those things are important. Controlling the other risk factors, like if they have diabetes, if they have blood pressure, that needs to be controlled. Can genetics play increasing role? Yes, genetics also contribute to about 10% of the heart attacks in young people, and this runs in families. Hence, if anybody in the family has an heart attack or heart diseases, it is wiser to check the heart condition of the siblings are important. And hence it is important for young people to know the family history, both maternal as well as paternal side family heart disease, history of heart diseases should be known to the siblings. And what are the steps, if you ask me, young people to take to prevent heart attacks, to recognize the heart attacks, is they should understand the symptomatology of heart attacks. They should know what are the symptoms, like the pain, chest pain, anything which comes and which is excruciating pain, which they have not felt in their life. If it comes, you should think of heart attacks. And especially the site is important. The site is at the center of the chest, or in the nape of the neck, or in the shoulders, both the shoulders. If there is a pain of any nature, please get yourself checked. And also the duration of pain is important. If it is lasting more than half an hour, you should get it checked. And what are the features, what are the diagnostic, how do we diagnose heart attacks in young people? The simple anybody with this history of pain, the symptomatology, and it is easier to diagnose. And to confirm, we have to do an ECG and see the changes on the ECG, which will tell you if ECGs are also normal. In about 30% ECGs can be normal, but certain investigations like doing a tropi test, which will detect the earliest sign of muscle damage, can be done as a biochemical test for diagnosing acute MI. And if it's still doubtful, you can always do an echocardiogram to identify the area at risk of heart attack. So are there any unique challenges in diagnosing heart attacks in young? Yes, young people, not only the patient, doctors also have a tendency to neglect the symptomatology of young people. They think this, he's only 20 years, he's only 30 years, there is no chance of heart attacks, no chance of heart diseases. It might be neglect is towards the gastric problem. But I think we should not neglect the symptom. We should go ahead and investigate, and then only make them give them the positive symptomatology is not related to heart disease, have to be ruled out by the doctors. Could you share some success? Yes, I have a lot of cases. The youngest person I have treated with a heart attack is 18-year-old, and a college student with severe pain, and he had while playing cricket, he was brought to the hospital. The ECG was done. It showed an extensive interval MI. Within 10 to 15 minutes, he was in the cath lab, and in one main artery, the left anterior descending artery, was occluded, and which was angioplasty, and about now 44 years. He is doing extremely well. There is absolutely no problem. So this is a very gratifying treatment we have, and life-saving procedures are available with us now. Only question is the identification or detection is important. The treatment is easier.